All right. So here we have case study number two. We have Margaret, age 32, which is a pretty large, pretty significant point in life where anxieties, you know, anxiety disorders really start blooming. So here we have Margaret. She came into counseling. She says she's starting to feel sensitive, emotional. She wanted to felt like sort her out. It's very possible that a year ago, especially when this started, she may have lost someone very important to her, perhaps her parents, or just one parent. It could be possible that because she lost someone, all these traumatic events could possibly be resurfacing. So we'll be talking about that as we go on. So first of all, let's go over some of the possible symptoms that I have proposed. Like she says she has. She says she's feeling anxiousness. She says she's feeling panic. She says she's feeling nervousness, and she says she has like a feeling of dread, or and even she goes on to saying that she has feelings of embarrassment. Now I feel like the key symptom here is really embarrassment when she's inside the store, the trolley. I feel like she may have had a past experience in the store where she may have, as a child, let's say, she was riding the trolley and she may have crashed into something. She may have caused a large mess, a very large sound, and those coupled together may cause a lot of unwanted attention. And usually, I feel like why I say she may have lost a parent is that maybe her mother was there, maybe she felt embarrassed, and usually when children notice their parents embarrassed, the embarrassment spreads to their child. And so I feel like that's all in correlation with one another. And especially with her recent mother's death, it could have brought back all those memories of her childhood where she may have embarrassed her mother a lot, maybe specifically in the store. And so I feel like her key diagnosis here is agoraphobia, but really I feel like embarrassment has more to do with social anxiety disorder, but those are my two best guesses. So it seems like because usually when you go into a store, you go into a store very generally, very commonly. It's a very common place to go for any person. So a couple of interventions that we could do with Margaret is that we could have her keep a note of herself, record herself for her thoughts and feelings whenever she's in the store, so that whenever she returns to the counseling sessions, we could help her with that a little bit better. Most of all, I feel like we should help her with controlling herself through the anxiety, and so breathing, self-talk, all of these things. When the anxiety kicks in, she should start practicing breathing and self-talk in order to help her control herself. And I feel like when people suffer anxiety, when they start to practice control, that's when they really start feeling better. Now, obviously, already the client has started showing signs of the wanting to improve. She says she looked online, she tried to help herself, which is a very big sign, and that helps her with the future prognosis that I'm going to say. Um, she says that she feels proud that she tries to really seek self-help on the internet, and she started to remember some of those tactics, and she already started using intervention tactics on herself, which is fantastic. As a therapist, however, I would have recommended desensitization. I would have gone to the specific store in question with her in order to kind of desensitize the store itself, and maybe even the people around her. Usually, when you go to a store, no one really cares about what you do in a store. It's like what you want to do in a store is what you want to do. Like you want to buy food, that's great. If you want to buy drinks, that's great. Like do what you want to do. And so I feel like she's over stressing that because she's afraid of being embarrassed again, and because if her mother passed away or her father passed away, like all these things, maybe one of the parents felt really embarrassed, and because other people maybe looking around her, she felt embarrassed, and that's how this all began. And so yeah, I feel like the sensitization is really the way to go, because that's all in the past. Number one, it's all in the past. It's not happening now, and although it's unfortunate that maybe her mother or father has passed away, it's possible that, you know, you just gotta get over it. Um, yeah. However, there is a problem here. Is that usually that's why I feel like she has agoraphobia. Is that she says I'm feeling anxious before going out, and I just stay in. And so that's I feel like one of the reasons why desensitization is probably one of the bigger problems. You could probably like bring a trolley to her house, and maybe she'll understand that a trolley is just a trolley. It's not gonna harm you in any way. Yeah, and so that's when maybe later on we could say that introduce her to the store again, and then just prove that no one really cares about what you're gonna do. So you just do what you want to do. Um, so I feel like my prognosis for Margaret is that number one, she's already seeking self help. She already has a desire to change herself, which is a big step, especially in a therapist's point of view. Um, and I feel like number two, we should start desensitizing the trolley in the shopping area. Perhaps we could recreate a certain area of the shopping mart where she feels the most anxiety, and then just kind of walk her through it and make her feel like there's nothing really going on. I mean, she's already showing signs of improvement by saying that she feels proud of herself of making her like feel like this is not really a big problem. That's a huge sign. And so I feel like with desensitization, she will fully recover within 1 to 2 months. And I think Margaret will be just fine. As long as if she can really just take care of herself, really, and control her anxiety. I think she'll be fine.